friends, recently I had a patient who had suffered a heart attack 1 year back, for which he had undergone angioplasty. He was doing good on medicines and suddenly he had one episode of loss of consciousness, what we call it as blackout. So they came to me. Now question is, what does a blackout episode implicates in such clinical scenario? So blackout in a patient who had suffered a heart attack or who had undergone a procedure, any heart related procedure, means patient may be getting arrhythmias, and these arrhythmias can be a warning sign for a cardiac arrest. So a patient who had suffered a heart attack in the past are prone to get ventricular tachycardias. Now ventricular tachycardias are the abnormal heart rhythms wherein the heart rate suddenly increases to 200 or 250. That leads to drop in the blood pressure and there is inadequate blood supply to the brain. Now many times if such increase in heart rate does not spontaneously normalize and if the blood pressure remains low for few minutes, it proves fatal, and this clinical scenario is called as cardiac arrest. So what is important is, if a patient with heart disease gets a blackout episode, he requires detailed evaluation, and this can be a warning sign for an impending cardiac arrest, and such episode should be taken very seriously and thoroughly investigated, and a consultation with a cardiologist should be done so that timely management can be done so as to prevent a fatal cardiac arrest.